Hi, everyone. I'm Justin Ayers. I'm the founder and CEO of Equality MD. This was me 6 years ago. I went to my dermatologist in Washington, D.C., and had to put on one of those awkward hospital gowns that no one likes to wear. As the doctor was about to begin the exam, I came out to him as gay. He stopped and told me he couldn't complete the exam because he didn't feel comfortable touching my skin. He abruptly left the room, leaving me feeling ignored, ridiculed, and unseen. Sadly, my experience is not uncommon. 1 in 4 LGBTQ Americans experience discrimination in a clinical setting, causing 1 in 5 to avoid care throughout their entire lives. 1 in 6 are denied care, as I was, and 1 in 8 live in states where providers can legally deny care to LGBTQ patients. Systemic discrimination has made the LGBTQ community an invisible, undermeasured patient population. Without patient journey data, health systems, payers, and employers can't make data-driven decisions that could increase patient engagement and improve patient outcomes. Notably, the LGBTQ community represents every other underserved demographic on Earth, from racial minorities to military veterans. Our solution is an inclusive virtual-first healthcare and data analytics platform. Our network of providers have completed evidence-based cultural competency training. Our machine learning matching algorithm connects patients with providers based on their unique identities. We transform new patient journey data into actionable insights for health systems, payers, and employers. Let's dive into our product. Jose is a fictional employee at Capital One. He's looking for a therapist who truly gets him. Thankfully, Capital One offers Equality MD as an employee benefit. When completing our intake form, Jose feels both seen and heard because we ask questions that speak to his various identities. From his personalized dashboard, Jose can schedule virtual and in-person appointments, manage his medications, and join community forums. Jose is matched with providers based on his needs and his preferences. He can change providers at any time, and his telehealth visits are all hosted within our app. Each provider has an equality score, which is based on their level of training and patient feedback. We'll sell our product to health systems, payers, and employers, and while we build our product, we have a quick path to revenue. We're launching a B2C telehealth solution this quarter. For less than $80 a month, users can have up to 36 healthcare visits per year. Customers can also access over 1,000 mail-order prescriptions for free. This is a great option for those without insurance or those who want to explore more inclusive options outside of their covered networks. 2 years ago, PitchBook said the LGBTQ healthcare market was over $216 billion. Our serviceable obtainable market is $8 billion, thanks to our enduring go-to-market partner, the National LGBT Chamber of Commerce. The National Chamber has 500 corporate sponsors, 53 regional chapters, and over 1.4 million members. We'll launch our initial product in Southern California, where the Chamber has 4 chapters. There are about 30 million LGBTQ Americans, and that number is growing as younger generations are increasingly comfortable coming out. By activating our network in the greater Los Angeles region, we'll capture over $4 million in monthly recurring revenue in about 2 years. There are a handful of companies that operate in the LGBTQ healthcare space, either delivering care or educating providers. 2 well-known companies are doing fabulous work for transgender patients, a population that accounts for about 4% of the LGBTQ community. Equality MD is the only company that requires evidence-based training, has an AI-informed matching algorithm embedded within a virtual-first healthcare platform that serves the entire LGBTQ community. We're also the only company developing new actionable insights about this particular patient population. We've hit several key milestones over the past 2 years. Our MVP customers gave us invaluable feedback that informed our path forward. We've signed contracts that enable us to go to market. We've secured over 30,000 patient interviews and surveys. We are the ideal team to meet the needs of our community because we have lived the problem we're solving. And while we can't do anything about those awful hospital gowns, we can change how the LGBTQ community perceives and receives care by empowering patients to become the superheroes of their own healthcare stories. Thank you for your interest in our story.